Thanks, Shelby. So now everybody has food coma, so we're going to talk about something really exciting like health insurance. So I was asked to talk about navigating insurance and finances, and I want to actually just start by sharing with you a little bit about what Triage Cancer does so you know where to go for more information on these topics. So Triage Cancer is a national nonprofit that provides free education on all of the legal and practical issues that come up after a cancer diagnosis, both for individuals who are diagnosed and their families and caregivers. And we do that by providing free education and resources. So we have educational materials, we have our legal and financial navigation program where we provide one-on-one assistance, and then we have free educational events. And those are live webinars that we also record and have available on our website for people to watch on their own. And then we also have our Triage Cancer conferences that we host throughout the year. So part of the challenge in talking about health insurance is that no one in the United States actually understands health insurance. And I used to just have that sort of anecdotal opinion based on the work that I do every day, but now there's data to back it up. Only 4% of Americans could actually define the 4 key terms that are used in health insurance. That means 96% of people can't. So it's not surprising then that only 40% of people can actually feel very confident in how to actually pick a health insurance plan that works best for them. So I want to talk about some of those key terms to get us started. And there are costs that we pay just to have health insurance coverage. Those are typically our premiums. Usually we pay those each month just to have health insurance coverage. But then there are costs that we pay each time we get medical care. And the first is our annual deductible. It's a fixed dollar amount that we have to pay first before our health insurance coverage even kicks in. So you might have a $50 deductible, or you could have a $5,000 deductible, depending on the plan that you have. And then there's something called a copayment. And this is also a fixed dollar amount that you pay when you get certain types of care. So you might have a $20 copayment to see your primary care physician, or you could have a $50 copayment to see a specialist, or maybe pay $300 if you have to go into the emergency room. But that's different from coinsurance or cost share. And these are 2 terms that are used the same way. So it's a percentage. It's the difference between what insurance companies pay for our medical expenses and what we pay for our medical expenses. So if you have an 80-20 cost share, the insurance company pays 80% and you're responsible for 20%. So Medicare Part B is an example of an 80-20 plan. And then probably the most important thing that anyone should know about their health insurance coverage is their out-of-pocket maximum, which is a fixed dollar amount that is the most that you'll pay for your health care out of pocket during the year. So the way that you reach your out-of-pocket maximum is a math problem. So you get to add up what you pay for your deductible plus what you pay for your copays and your coinsurance amounts to help you reach that out-of-pocket maximum. And when you do, then your insurance kicks in at 100% for the rest of the year for all of your medical care. So it allows you to plan around that worst case scenario of the most that you would have to pay out of pocket. So to give you an example of how this actually works, Dan has a plan with a $2,000 deductible. It's an 80-20 plan, and he has an $8,000 out-of-pocket maximum. But he spends a week in the hospital, and he walks out with a $102,000 hospital bill. So assuming he's had no other medical expenses during the year, how much does he actually have to pay for that medical bill? Any ideas? It's $8,000 because that's his out-of-pocket maximum, but this is how you get there. So first he spends he has to pay his $2,000 deductible, which leaves $100,000 left of that bill. But he has an 80-20 plan, so the insurance company is gonna pay 80%, and he's responsible for 20%, which leaves him with a $20,000 bill. But how much does he actually have to pay of that $20,000 bill? $6,000, because he's already paid his $2,000 deductible, and he has an $8,000 out-of-pocket maximum, so he only spends another $6,000 to reach that $8,000 out-of-pocket maximum. Now, I'm not saying only $8,000, like $8,000 isn't a lot of money, but at least you know it's a maximum that you'll have to pay out of pocket for your medical expenses during the year, as opposed to that $20,000 bill that he would have been left with. So that's generally how out-of-pocket maximums work. There are lots of details, and so when I spend time talking about the law and talking about health insurance, the devil really is in the details. Because you might have a family plan where there's an individual out-of-pocket maximum and a family out-of-pocket maximum. If you have a marketplace plan, the out-of-pocket maximums are required to be comprehensive. They're the most consumer protective out-of-pocket maximums in that they have to include copays, deductibles, and coinsurance amounts for both medical care and prescription drugs. Whereas employer plans can carve those things out. So some employer plans don't include deductibles in the out-of-pocket maximum. Some don't include copayments. Some don't include those prescription drugs. Then they have a separate out-of-pocket maximum for prescription drugs. So while I say this is the most important thing for people to know about their health insurance, this is why. It's because there are differences, and it allows you to plan around that worst-case scenario. Now, in the United States, there's only 3 places where we get our health insurance coverage. We're either getting it directly from an insurance company, we're getting it through the government, and by that I mean Medicare, Medicaid, military and veterans plans, the Indian Health Service, state and local programs, but about 50% of people still get their health insurance coverage through an employer. Now, at Triage Cancer, we feel really strongly that the #1 way to lower the financial burden of a cancer diagnosis is by having adequate health insurance coverage. So not just having insurance, but making sure it works best for you and actually leaves you with the lowest out-of-pocket costs. But that really means that you have to know all of your health insurance options, and not just the one that is most popular, or you might be most familiar with, or maybe that your employer presented you with, but to really understand all of your options so you can pick the best plan for you. And at Triage Cancer, we have a whole lot of resources to help you figure out your options. But just to give you an example, Medicare is a federal health insurance program that is only available to individuals who are over the age of 65 and eligible for Social Security retirement benefits, or who have been receiving Social Security disability insurance benefits for at least 2 years, or if you have end-stage renal disease or ALS. Those are 2 medical conditions that automatically qualify you for Medicare. Now, most people think about Medicare as one thing, but even in Medicare, you have a whole lot of choices that you need to make. So the standard Medicare coverage, what we call original Medicare, is Part A and Part B, because that's all that existed in 1965 when it was signed into law. Part A of Medicare is going to cover hospitalization. It also covers some skilled nursing care and hospice care and home health care. But then there's also Part B, and that's really the core of Medicare coverage. It's your medical insurance. It's covering your outpatient care, your IV chemotherapy, durable medical equipment. All of those things fall under Medicare Part B. But it doesn't include prescription drug coverage, which is actually covered under Medicare Part D. So once you have original Medicare, when you become eligible, you have to decide, do you also want prescription drug coverage? And the answer is yes. Yes, you do. So you pick a Medicare Part D plan, which is sold by private insurance companies, but all of that coverage still has out-of-pocket costs that you have to pay. And I already mentioned that Medicare Part B is an 80-20 plan, which means you're responsible for 20% of anything that you get under Medicare Part B. And there's no out-of-pocket maximum, meaning you're responsible for that 20% all year long. And so what people do in response to that and those astronomical out-of-pocket costs is they buy supplemental coverage, which is referred to as a supplemental Medicare plan or a Medigap plan. So those are also sold by private insurance companies, and you have to actually find the plan that works best for you. So that's what we call lane 1 of Medicare. But there is a second lane that you can drive down with respect to Medicare, and that's Medicare Part C, or Medicare Advantage plans. These are also sold by private insurance companies, and they're what you would kind of traditionally think of as your HMO or PPO, where you're choosing to go to a specific network of providers, and the care is coordinated, but you might have lower costs for Medicare Part C. So for some people, Part C is very attractive. Most Part C plans, about 90% of them, also include prescription drug coverage, but if they don't, and you pick that plan, you also need to consider a Part D plan. And that's where Lane 2 ends. You can't buy a Medigap plan with Lane 2 because it actually does have an out-of-pocket maximum. And with that out-of-pocket maximum, it's capping your costs, so they don't allow you to buy a Medigap plan with Lane 2. So there are pros and cons to each of these lanes. Original Medicare, it's a fee-for-service system, meaning you can go to any provider you want to and not have to worry about networks of providers, whereas Part C can often be less expensive. And so there are actual choices here for you to make that are going to have an impact on the cost of your care and your access to care. I want to talk about Part D for a second because there have been some changes that have happened and that are coming down the pike. So the way that a standard Part D prescription drug plan works in Medicare is first you pay a deductible. And this year, the deductible for Part D plans is $505. Then Medicare Part D kicks in and pays 75% of your prescription drug costs, and you're responsible for 25% of your prescription drug costs. And then, once your out-of-pocket total drug costs reach $7,400 this year, then you enter what's called the catastrophic coverage phase. So there is no out-of-pocket maximum for Part D right now. And once you hit the catastrophic coverage phase, then you're responsible for Medicare pays 95%, and you're still responsible for 5% of your prescription drug costs all year long. Or, if it's more, then you'd only be paying a brand name cost of $10.35. But generally, when we're talking about cancer care, you're going to be paying 5% of your prescription drug costs all year long. And it's not capped. So I apologize that the formatting on this slide looks a little funky here. So 5% can add up to a whole lot if your prescription drug costs are $10,000 a month, and you're paying that all year long. So Congress just passed the Inflation Reduction Act last year, and in 2024, it will eliminate that 5% catastrophic coverage. So you don't have to pay the 5% all year long. Once you reach the catastrophic phase, then Medicare will kick in at 100% of your prescription drug costs. Then in 2025, it will actually cap your out-of-pocket drug costs at $2,000. So generally, what that means in 2024 is your drug costs will be capped at about $7,500 for the year. We don't know exactly what those numbers will look like for next year yet. And then in 2025, it will be capped at $2,000. So from an infinite amount of money that you might have to be paying for prescription drugs to $7,500 next year to $2,000 in 2025. So this was pretty significant legislation, particularly for the cancer community, where there are very high costs of drugs for anyone who receives Medicare. So we do have a lot of resources specifically around Medicare to help people navigate these choices and to understand their out-of-pocket costs, including a worksheet to help you compare plans. And we're about to come out with one to compare Part D plans soon. So I want to walk you through a quick exercise that you can use if you're trying to actually compare your plan choices. So you can use this if you're comparing marketplace plans. You can compare choices that your employer gives you for health insurance coverage. You can compare what your employer gives you to what's in the marketplace, or you can compare those Medicare Advantage plans using the same exercise. So here we have 3 plans. There's a bronze plan at $200 a month with an $8,000 out-of-pocket maximum, a silver plan at $275 a month with a $6,000 out-of-pocket maximum, and a platinum plan at $400 a month with a $2,000 out-of-pocket maximum. Now, can you tell just by looking at these plans which is actually going to cost you the least by the end of the year? No. The answer is no. You can't tell just by looking at them. You actually have to do the math. And the way that you do the math is that you take the monthly premium and you multiply it by 12 because that's how much it will cost you to have the plan for the year, and then you add that to the out-of-pocket maximum. So in this case, it turns out that the platinum level plan, despite the fact that we get sticker shock when we look at the monthly premium, actually ends up saving you thousands of dollars by the end of the year. And unfortunately, most people shop for health insurance by just looking at that monthly premium because most people don't understand how out-of-pocket maximums work. And so when we talk about how you actually lower your out-of-pocket costs and we minimize the financial burden of a cancer diagnosis, this is actually the #1 way to do it. And when we use examples related to Medicare, it can even be that much more significant in the differences in cost. But it isn't just cost that you have to look at. You actually have to make sure that any plan that you're looking at does cover your providers. Because if it doesn't cover your providers, it's going to be pretty useless to you. So you want to make sure that the hospitals that you go to, the doctors that you see, the pharmacies that you go to, and the prescription drugs that you take are all actually covered by the plan that you're looking at. And there are tools to actually help you do that, whether you have a marketplace plan or an employer plan, or you have Medicare or even Medicaid. We do have resources to help people pick a health insurance plan, including an animated video, and our worksheet that helps you compare plans and do the math that I just walked us through. So even if you have the best health insurance coverage, you are still going to have to deal with medical bills, and that can mean a lot of paper. And it might be actual paper or it might be electronic paper, depending on how your providers are sending you bills and how your insurance company is sending you paperwork. So generally, that paperwork includes notifications from your insurance company that says, we've received a claim, meaning your provider has sent them a bill to look at. Then they might send you a letter that says, we're processing your claim. You don't actually have to do anything with that, they're just letting you know. But ultimately, they'll send you an explanation of benefits. And this is the most important piece of paper that you want from your insurance company, because it explains how they handled your claim, what they've paid for it, and what they expect you to pay your provider for that care. And you want to make sure that that information makes sense to you and that they haven't actually denied a coverage for your claim. The explanation of benefits looks something like this. It's generally got a chart. It's got your information about the claim. It's got codes on it. But the most important thing for you to look for on the explanation of benefits is somewhere on it, it says, this is not a bill. You do not want to pay your explanation of benefits. So then the last piece of paper you're going to likely get if you go and seek medical care is the bill from your provider. And you don't want to pay that bill until you've received your explanation of benefits from the insurance company, because you want to make sure those two things match. It often happens where the providers are faster than the insurance companies, where they might send you a bill before they've ever received notification from the insurance company how the insurance company is going to handle that bill. And I will tell you from personal experience, seeing that bill from the provider might be heart attack inducing if you haven't gotten any payment from the insurance company yet. So you want to make sure that you're actually matching up those documents before you pay the bill to the provider. Because if you end up paying more than you need to, you're going to have to chase down that money from your provider, and you don't want to have to do that. So you also want to make sure that the bill is correct. Medical billing is a human process, and so there are typos often, whether it's in coding, whether it's in how many surgeries you actually received, if it's 1 versus 11. These things actually happen. There's a very high percentage of errors in medical bills, so you just want to make sure that it's correct. And if you have any questions about it, you're talking both to your provider and to your insurance company. But most importantly, if your insurance company does deny coverage for your care, you need to appeal it. When an insurance company denies coverage, you have the right to go back to the insurance company and say, I'd like you to reconsider. So that process is called an internal appeal. If the insurance company still says, no, we're not going to cover your care, you have the right to an external appeal if you have private health insurance, meaning if you have a marketplace plan or an employer plan or another type of individual health insurance plan. There is a federal law that requires those plans to provide you the right to external appeal, meaning you get to go to an independent entity to see what they think and whether or not the care that you received is medically necessary. This is actually a huge consumer protection that no one knows about. And when I say no one, I actually mean no one. So this is data just from the marketplace plans from 2021, where there were 45-ish million claims that were denied in 2021, but only 0.01% of those claims even made it to the internal appeals process. So that means 99.9% of people are totally taking no for an answer, and their insurance company are denying their claims, and what that practically means is that people either aren't getting access to the care that their healthcare team prescribed for them because their insurance company denied it, or they're paying for it out of pocket when their insurance company should have paid for it. And so when we talk about the financial burden of serious medical conditions, lack of knowledge about the appeals process is contributing to that as well. So I strongly recommend that if you are ever denied coverage, that you appeal that decision, because the data shows that the external appeals process is actually successful for patients up to 60% of the time. So it's a process that actually works for patients who use it. So we do have a lot of resources to help people navigate the appeals process, including a resource called Cancer Finances, where the first question it asks you is what type of insurance you have, and then it explains the appeals process based on the type of insurance that you have. So related to medical bills, we often say that the worst place where you can go for information about health insurance is the news, because the news uses terms interchangeably that actually don't mean the same thing. And a good example of this is surprise billing and balance billing. Surprise billing is where you need to have surgery, you pick a hospital and a surgeon who are in your insurance company's network, and you have your surgery and you go home, and then you find out that you have a surprise bill from the anesthesiologist who is in your surgery, because the anesthesiologist was outside of your insurance company's network. And this actually happens frequently. So frequently that all of these states listed on the slide actually started to pass state legislation to protect patients from surprise billing. Then there's balance billing. Balance billing is when you know you're going to an out-of-network provider, and maybe that provider is going to charge you $100. And you have an insurance plan that actually pays 50% if you're going to go out of network. So your insurance plan pays 50%, and then the provider bills you for the other 50%. They're billing you for the balance of their bill, and they're allowed to do that because they're an out-of-network provider, and you are responsible for paying that additional $50. But if you're going to an in-network provider, they are not allowed to balance bill you. So if the provider charges you $100 and the allowed amount for that care is $70, that provider cannot balance bill you for the additional $30. They have to accept the $70 payment from the insurance company. So balance billing and surprise billing can feel similar, but they don't actually mean the same thing. So then the federal government got involved, and starting January 1st of last year, we got the No Surprises Act going into effect to protect patients from those surprise bills. So now, if a patient receives that surprise bill from their anesthesiologist, they can actually call the federal government for help. There is literally the No Surprises Help Desk, and they can call that 800 number to get help with a surprise bill, or you can actually submit your bill online to CMS, and they will work with the provider and the insurance company to resolve your surprise bill. I will say they got a little bit inundated at the beginning of next year with those surprise bills. Now we're headed into tax time, and with tax time comes figuring out your medical expenses. So it's incredibly important for you to keep track of all the things that came up as expenses that you can use to reduce your taxes, meaning you pay less in taxes and you get a higher return. So in a practical sense, keeping track of that paperwork can actually save you a whole lot of money. And I don't just mean the bills that you're getting from your providers, but if you have to travel to treatment, that transportation and lodging expense could be tax deductible. The food even that you're eating while you're traveling to treatment could be a tax deductible expense. So keeping track of all of that can be helpful. And at Triage, we've actually created a resource to help people do that. So we have what's called our medical bill tracker that you can download from our website, and it's actually an Excel spreadsheet. And it allows you to plug in the medical bills that you have paid and received, and it will show you how much you need to actually meet your out-of-pocket maximum. So this is just a blown up slide of the top of the medical bill tracker where you add in the name of your plan, your deductible, and your out-of-pocket maximum, and the formulas actually calculate for you how much you have left to meet your deductible and to meet your out-of-pocket maximum. So you can just plug in the bill and how much you paid and how much your insurance company made, and it will do the work for you. So I want to talk about prescription drugs for just a second, because you might find when you go to pick up a prescription drug from the pharmacy that you have an incredibly high copayment that you have to pay to pick up your drug. And the data on the number of people who walk away from a pharmacy without their drugs because they can't afford the copays is incredibly high. And we don't want anyone to ever be in that situation. So if you do find that you have a very high copayment, you have to ask a key question of the pharmacist. And the key question is, how much would it cost if I didn't use my insurance to get access to the drug, and I used a drug discount card instead? So there are tons of drug discount cards out there. We happen to have one in partnership with Needy Meds, and I have actually personally tested it to see if this works because it kind of seems too good to be true. But you can go in and show them this card, and they might say, oh, we don't take that drug discount program, but we do take this one. Or let's look it up on another program. So the pharmacist can actually be a great partner in trying to lower your out-of-pocket costs, but they won't know to do that if you don't ask the question. Very rarely will a pharmacist offer up the fact that there might be a way to lower your copayment. And so I actually look at this drug discount card as just a tool to remind you to ask the question. What would it cost if I didn't use my insurance and used a drug discount card instead? Now, the downside to doing that is if you do use a drug discount card and it doesn't go through your insurance, then it's not going to meet your out-of-pocket maximum. So it's not going to be charged to your insurance and kind of show up in the system as you having to pay that out-of-pocket cost to help you reach your out-of-pocket maximum. So that's a choice. But this can be incredibly helpful, and about 80% of the time it's actually lowering people's costs when they go for copayments. The other thing that people don't realize is what you might pay for a drug could be very different based on the pharmacy that you're going to. So you want to ask the question, which pharmacies are in my insurance company's network, but know that if you went to, I won't use any names, but if you went to X pharmacy, you might pay $200 out of pocket, but if you went to Y pharmacy, you might only pay $20 out of pocket. It can be vastly different, so don't ever assume that it would be the same based on where you go. So you can actually shop around to see where you have the lowest out-of-pocket costs. So I mentioned that we have a tool called Cancer Finances, and this is an online interactive tool where you can pick a topic that can actually impact your financial situation to learn more about that situation, and then it starts to ask you questions. And the way that you answer those questions based on what you're looking for or your personal situation, it will tailor the information to give you the answers that are relevant to your situation. So you get directed to the information that's most helpful for you. We do have 2 places where you can find financial assistance information if you're looking for it. We have a whole module just on financial assistance resources, and it's everything from house cleaning to copay assistance. And then we also have an entire section on prescription drugs. So not only does it have all of the private programs that provide financial assistance, but it also includes all the companies out there that have assistance programs to lower your copayments or potentially even get you access to free drug based on your situation. So all of that is housed there as well. And then the last thing that I want to mention before taking some questions is that we do have a legal and financial navigation program. And this is where we are providing free one-on-one help to anyone who has questions about their situation. So if you have questions about your health insurance options or how to compare them or understanding your work situation and whether or not you want to work through treatment or take time off, or even the decision about should I just retire as opposed to continue to work, we have information about the laws at the federal and state level that apply to your situation and can help you weigh the pros and cons so that you can make decisions about what's best for you moving forward. Everything that we do at Triage Cancer is entirely free of charge. And if you go to our website, you can fill out a form to schedule an appointment with one of our staff. So with that, I will stop and take questions. Thank you. Thank you. Does anyone have any questions about anything that I shared or maybe some of the other topics that we cover at Triage Cancer? You all are very easy on me today.
Sorry, I have a question, Joanna. You mentioned some of the slide thinking back to the new laws with Medicare and looking forward to 2024 and 2025, I think.
Yes.
And some of the caps, I believe. And then there was a slide on like discount cards. Yes. Is there so I'm guessing just looking ahead at like 2024, 2025, is there, would people maybe not need those discount cards because of the cap on the, out-of-pocket maximum?
So the Inflation Reduction Act, in terms of capping the out-of-pocket costs for prescription drugs, only applies to Medicare. So if you have private insurance, there is likely still going to be a need for drug discount cards and other financial assistance programs. With Medicare, there are actual limits on the types of financial assistance that can be provided to someone who is on Medicare for their prescription drugs. And so it's really limited to private organizations that are providing the financial assistance. With Medicare, it's the same thing. If you choose not to pick up a prescription drug using Medicare, you can still use the drug discount card. In most cases, it depends on the program, but generally speaking, we're hoping that the cap on the out-of-pocket costs will greatly reduce that burden. Yes. Oh, wait for he went that way and I went this way.
Quick one. So if I take Social Security at 62, do I still have to wait till 65 to get Medicaid?
Yes.
Well, that stinks.
So then you're thinking about what are your other insurance options that can help you bridge that gap till you reach 65.
Yeah.
And for most people, if you're leaving work to retire early, then you're looking at COBRA if you get health insurance coverage through an employer versus the marketplace, really. Those are your two biggest options. And sometimes COBRA can be better than what's in the marketplace, and sometimes marketplace is better than what's in COBRA. It really just depends on the quality of the employer plan that you had access to before and the state that you live in and what options are available in the marketplace.
How do the discount programs work? How are they making money? Why are they giving it away? What information are they getting from me?
That's a great question. So in terms of discount programs, it is very different based on who's offering the discount program. So there are pharmaceutical companies that are providing drug discount programs to help with the copay assistance. So they make their money primarily through the sale of drugs. And then there are private organizations like Health Wealth Foundation, for example, that provides financial assistance to help offset the cost of copayments for medical care and prescription drugs. And so those organizations are raising the money to be able to provide the financial assistance. And that could come from anywhere. So even individuals contribute to those organizations. And then the drug discount cards specifically are about contracting. And so that the transparency and how those contracts work is actually something that everybody in the United States is trying to understand, how pharmacy benefit managers and PBMs and insurance companies and drug manufacturers all work together to come up with pricing and how it gets passed along ultimately to the patient. That is a bit of a mystery in terms of transparency in the process. And so there are literally congressional hearings going on right now about PBMs and their role in that process. But generally, it's contracting. So it's contracting between the drug companies and PBMs and the pharmacies to give you those drugs at a lower cost.
Any other questions? Because I have one. So I took notice of your, I don't know what to call it. I'll call it a pie chart, but it really just looked like a blue chocolate cake because it was all the same color. So alarming. And Zero's comprehensive patient support program that you're familiar with, Zero 360, 77% of users call for financial reasons, and the majority of those are insurance appeals. And I think they're inching up in close to $7 million put back into the pockets of patients. But it just makes me wonder, is it, some of it's error, right? You said it's human. Some of it feels malicious, right? That we're gonna say no, and then we're gonna make you do the work, and then we're gonna maybe mostly like say yes. Is there any reasoning or thoughts behind that?
It's a business model. It is actually the business model. So without sounding sarcastic, it is set up to do that so that the insurance companies deny and then hope no one questions it. And that includes providers as much as patients. And some providers will do the appeal on your behalf, so you might not even ever know that they did that appeal on your behalf because they didn't make any changes to your upcoming appointment. But most people, let me phrase it this way, ultimately patients are responsible for the appeal. And so if a provider doesn't do it for you, you still can do it on your own behalf. I strongly encourage you to engage your healthcare team in the process because it's very helpful to have them provide the medical justification for why they prescribed a particular treatment. But ultimately, it does fall on the patient to have to go through the appeals process if a provider doesn't do it for you. So, which is why we try to make people aware of the process and give them tools to help them actually go through the process. I will also just say that the state insurance agency can be very helpful to you in that process. I know that doesn't really sound believable, but depending on the state that you live in, they can be incredibly helpful in navigating patients through the appeals process, especially the external appeals process. So we always say it's important to use your resources. I would definitely point to them as well. Thank you.